Deborah's here. We just finished her Botox as a maintenance. She has that every 6 months. But she has a little bit of loss of volume in the cheeks. Smile for me, Deborah. She looks so much better when she smiles. Now relax, as most of us do. So we're going to add volume here with the Contour. Contour is the latest Galderma filler. It's FDA approved for the cheek area, the mid-face area. So what we want to do, it simulates having a little more volume, and even simulating a cheek implant. So it gives her a little more oval face, which is more youthful. So she's already been numbed. We've done a little block on her. So we'll first use, let's see, we'll go to this side first. So smile and relax. So again, does that hurt at all? Debbie, you okay?
Nope.
A little pinchy, a little bit. So we're adding the Contour. And she's going to go right back to the office after that, this, which is nice. And you can see immediately, just that little bit, how it makes a difference. Here, you can see too, see in the mirror?
Ah, yes.
See how it gives you a little more of a volume here?
Yeah, distinction.
And you're flatter here. So I'm going to do a little bit more. You can hang on to the mirror. Contour is nice because it has a high G prime. So the studies say that it's going to last a year, but the really important thing is that we're trying to build up her collagen. So as this disintegrates, it stimulates her own collagen. But you can see how now she has some cheekbone, whereas before this one is flatter. Now just a tiny bit more, and then we'll go to the other side. Okay?
I'm good.
So again, I'll put a little bit of our special secrets anti-bruise sauce on there. That's not a bruise, that's a little blemish that she has. But yeah, take a look in the mirror now. See how
Yeah.
you're more oval on that
difference.
side.
Yep.
You see that, Marsha?
Mm-hmm.
Okay. So we have a little pressure here, and we'll do the other side.
Okay.